Thank you, everyone, and good morning. I'm Leocadia Conlon, and it is a privilege for me to be on this stage with Terri Tanielian. She is an accomplished researcher who has done so much to raise awareness about the issues that face our U.S. veteran population. And I want to thank Senator Elizabeth Dole for her leadership and advocacy for military caregivers. It is an honor for me to be a part of this discussion that was made possible by the research that her foundation commissioned. You have heard a lot about veterans' health issues at this conference, or at least I hope you had. That's because caring for veterans and military families is a high priority at AAPA. With thousands of veterans or thousands of troops repeatedly deployed for well over a decade now, the health and well-being of our veteran population is a topic of growing national concern. The effects of military service on the physical and psychological health of military members and their families is complex and often not well understood. Today, Terri and I are going to talk about one part of that population, military caregivers. We hope that this sparks conversation among all of us about what we as PAs can be doing in our clinics regarding this patient population. And that's because this issue is not just confined to the walls of the Department of Defense or VA clinics. Veterans and their families live in your communities. They will be seen across all clinical settings, across all medical specialties. So Terri, should we get started and talk about your research and see what we can learn from you that we can be doing in clinical practice?
Sure.
First, Terri, can you define for us from your research who is a military caregiver?
Sure. Well, first, thank you. Thank you for the opportunity to be here, and thank you to all of you for coming to hear a little bit more about this important population. A military caregiver is someone who provides informal care and support and assistance for a current or former military service member who suffered a disabling injury or illness as part of their military service. They may be spouses, husbands, or wives. They may be parents, moms, dads, siblings, children of the wounded, as well as other friends. They provide critical assistance at the bedside and throughout the long-term recovery trajectory, all the way through rehabilitation and reintegration into their homes. They provide assistance with activities of daily living, such as feeding, bathing, dressing, and helping with toileting. They may also provide assistance with what's called instrumental activities of daily living, such as scheduling and providing transportation to medical appointments, ensuring that the meals are appropriately prepared to ensure good nutrition and health. They may also serve as critical connectors with the healthcare system and providers. So they take on quite a diverse set of roles for our military service members.
And could you just define, if we say military caregiver, is that the same as veteran caregiver? Can they be interchanged, those terms?
We use the term military caregiver to refer to anyone who provides care and assistance for a current military service member while they're still in uniform and associated with the Department of Defense, as well as a former service member, so they may have transitioned to veteran status. So when we say military caregiver, we're talking about those individuals who provide support for either those still on active duty or in reserve status, or those who've transitioned to veteran status.
And can you expand a little more on the role of a military caregiver and maybe talk a little bit more about the injuries that they're seeing in their spouse or loved one that they're caring for?
Sure. Well, these conflicts have certainly yielded some signature injuries of the wars, if you will. While we've seen very low rates of amputations, we have seen, because of our body armor and our medical evacuation assets that are just superior, we have many more individuals surviving wounds that they would have in years past succumbed to. So as individuals come home, they're coming home with traumatic injuries. As I mentioned, low rates of amputations compared to prior conflicts. However, we're seeing what we call invisible wounds, so post-traumatic stress disorder, traumatic brain injuries, as well as other kind of mental health-related consequences associated with depression and substance use. So these caregivers are trying to deal with what are complex traumatic injuries, both physical as well as emotional.
And can you talk about something, post-traumatic stress disorder, what caregiving is? You had talked before, when we've gotten a chance to talk, about trigger control. Can you talk a little bit about that? Because I think that's a unique aspect that these caregivers have to do that we wouldn't think about.
Sure. One thing that we learned when we talked to groups of military caregivers is that they really are the buffer for their veterans. So trying to understand and learn to filter and control triggers, things that may be upsetting, things that could cause reactions, and to try and moderate their mood and reactions. So they are kind of becoming that buffer to try and moderate against triggers. If it's noise, to try and keep things quiet. If it's large crowds, to try and keep them in small settings. And so they really are that buffer for individuals with post-traumatic stress disorder. And we heard from the caregivers that can be really quite overwhelming. It's much different than caring to a physical wound where you may just have to do dressing care and medication. This is much more complex because it's not just medication and therapy, it's also monitoring the environment to ensure that those things are filtered for the service member and veteran.
Senator Dole mentioned this is one of the only research studies being done, and as I understand it is ongoing research on military caregiver. Why now, and maybe why has this not been done in the past?
Sure. Well, certainly over the past decade, we've seen that the enormous amount of attention has been paid to our returning veterans and troops to try and understand the consequences that they face and what remedies may be needed to address them. And military caregivers have received some attention. There was one survey that was done in 2010 by the National Alliance of Caregiving that shed some light on the issues that caregivers face. But there hasn't been a comprehensive assessment that has looked objectively, specifically at the caregiver population to understand their health needs, the burdens that they face, the vulnerabilities that are created associated with their role. So to really ensure that their needs are met, which in turn will ensure that they can meet their veterans' need, we are in the process of doing phase 2 of our caregiver study to try and understand specifically the issues and challenges that they face and what gaps may exist in the systems to address them so that we can recommend how to fill those gaps and carve out a potential national strategy to serve military caregivers.
I think when we talk about veterans and the military population these days, we immediately just think of Iraq and Afghanistan. Are these the caregivers your study looks at, or are we looking at other veteran caregiver populations?
Certainly the veterans of Iraq and Afghanistan are receiving a lot of attention, and they are a population on which we have a lot of information and data so that we can try to focus in and look at the caregivers for those individuals. And our study is prioritizing Iraq and Afghanistan veterans, but we can't forget about the caregivers for veterans of prior eras, such as World War II, Vietnam, and Korea. Those veterans also may require caregiving assistance, and their caregivers may be facing burdens as well. And so while a number of programs and legislation is focused on the post-9/11 caregivers, we're hoping to be able to yield some insights that can be applicable to caregivers of older veterans as well.
Do we know what this population is, the number, the size of a military caregiver population in the United States?
There's been no rigorous studies done to date to try and estimate the size of this population. So what we tried to do was use some crude estimation methodologies, back of the envelope, to try and calculate the number of potential caregivers for the Iraq and Afghanistan era veterans. And using data about the total size of the population, the proportion that had been medically evacuated from theater and so could potentially require caregiving assistance, as well as what we know about the consequences that may develop once they return home, such as post-traumatic stress disorder and depression, and both using conservative as well as liberal estimates about how many of those require caregiving assistance. We estimate that there could be as many as 1.1 million individuals. These, again, are husbands, wives, parents, children who are providing support to Iraq and Afghanistan veterans. Now, we know we've excluded some important groups. We've excluded those that may have musculoskeletal problems that are presenting to the VA that haven't been published rates and counted. We also know that we're excluding veterans from prior eras. And so 1.1 seems like a very large number, but it also may be an underestimate of the number of caregivers who are serving our military veterans today.
Sure, absolutely. Military caregivers, certainly they're not the only caregivers in the United States, but your research revealed some unique characteristics about military caregivers versus other caregivers in the US population. Can you talk about that?
Sure. Fortunately, there's been a fair amount of research done on civilian caregiving. And what we've learned is that the typical caregiver in the civilian sector is a 50-year-old woman who is caring for a parent with dementia, Alzheimer, but doesn't necessarily live in the home with that individual. what little data are available about military caregivers suggests that military caregivers are younger on average. They're more likely to be married to the veteran that they're caring for, therefore living with them. They also are called upon, because they live with them, in a 24/7 capacity and really rely upon other sources of support and caregiving assistance, such as their children and extended family. So what this suggests is that while we can learn from what we know about civilian caregivers, military caregivers are a different population, and they may be dealing with different sets of issues that require us to do a little bit more investigation to ensure that the services and care systems are really appropriately targeted for them.
When you talk about the younger ages, a younger family, I'm reminded of a young family I had treated once in a military hospital in an ER. They came in, it was a 7-year-old, he had a laceration, a simple laceration from typical childhood rough and tough play. And as I was suturing him, I was talking to the family. It was the 7-year-old child, he had about an 11-year-old sister, and the mom was in her 30s. And they shared with me as I was suturing that their dad was coming home from his 3rd deployment to Iraq the next day. So I said, which just seemed normal, "You must be excited." And they all said at the same time, "We're actually dreading it." And you can imagine my shock and not knowing what to say. What has your research shown? What burdens are these families going through that would warrant such a response?
Sure. Well, this is a parent who had deployed multiple times, and so this family had been through many transitions, if you will. And the process of coming home is a transition, and it can be one that's overwhelming. The idea of coming home, reintegrating into the family and community can be very stressful on the family. They have to readjust their routines, kind of reestablish roles, reconnect, if you will, with that person who's been missing for a period of time. They may have gotten used to doing things a certain way, and now they have to change. At the same time, they may be a little fearful of the unknown. They don't necessarily know if dad's going to come back the same person, if he's going to have difficulty sleeping, or if he's going to be agitated or experience some of the other symptoms of post-traumatic stress disorder. And while there's been an enormous amount of effort put into transition assistance programs and reintegration programs, it's still very overwhelming and anxiety-provoking for the family to try and figure out how do we get back to our new normal, and how do we readjust and establish our roles at home. And so it can be quite overwhelming.
And certainly, it's not an ideal situation for anybody, right? I mean, the member that's coming home at the very least is dealing with readjustment issues while the family is. What can we do for families, or what could have maybe I just said at that point of care? I mean, they were there for a laceration, something totally unrelated. But it's at those points of care that we don't want to miss opportunities. What could have been done for that family or said at that time?
Well, it's possible to try and understand a little bit more about what specifically they're dreading, to understand what is causing them that anxiety, what are the particular concerns they have, and then if you're aware of the community resources and the ability to actually provide them with some recommendations about referrals or other sources of support to try and help them get through that process, that may be reassuring. But at the basic level, just understanding, really acknowledging the fact that you recognize that this can be a stressful and uncertain time for the family as they readjust to the service member coming home.
Sure. We had the opportunity to have a patient caregiver panel here yesterday. I hope some of you out there were able to attend it. It was very powerful. We had 2 veterans who had suffered TBI and post-traumatic stress disorder, and 2 of the caregivers. And one of them talked about just that, just being validated, not understanding that caregiving is a burden. Another one said that she didn't realize that she might need help until her husband's psychiatrist walked in on her having a breakdown as they were waiting for an appointment. Your research did look a little bit at what resources or services are available to them. Can you speak about that a little bit so we know what's out there?
Sure, and we found that while there are a number of resources and services and programs available, it's almost a dizzying array, kind of like a complicated maze of information, websites, programs to try and understand and disentangle. And so, caregivers are looking to find information and training, a little bit about the clinical conditions that their service member or veteran may be facing to try and understand what they can do to provide the appropriate support. So information about the conditions and information about the caregiving role could be helpful. And there are some programs available. The efficacy or effectiveness of those, of course, is somewhat unknown, but referring them to some training programs. At the same time, they're looking for, to make connections to other caregivers. So looking for their peer network so that they can learn from others that have kind of walked in their shoes. Hopefully pick up some tips along the way and learn not to make some of the same mistakes. There are also kind of other aids, if you will, scheduling tools that can help them keep track of medications, keep track of appointments. There are opportunities for them to go to retreats and to gain respite care. Again, a dizzying array. They may also be eligible for specific benefits for themselves if they qualify for one of the compensation programs through the Department of Defense or the Department of Veterans Affairs. And so what's confusing, though, is to try and understand what are the eligibility requirements for these specific programs. Are they eligible, and what services can they obtain through those sources?
Do you know how we as PAs can find out, at least where to direct them to, if they have no idea, to find out what they are eligible for?
Well, there are websites both available from the Department of Veterans Affairs as well as the Department of Defense, but I would also direct you to Elizabeth Dole Foundation website to learn about some of the fabulous programs that are going on with her innovative grantees and some of the things that they're doing to support caregivers. And in several months, our forthcoming report will really provide a complete catalog and inventory of the available programs and services to support caregivers.
Great. And I will say we have a resource page up at AAPA. We have a Caring for Veterans and Military Family page. It's aapa.org/veterans. And we keep that updated. And certainly after conference, I'm going to go back and update with more references and resources we learned about at this conference. We will put the Elizabeth Dole Foundation on there. And it is meant to be at one place where you can go and see several resources for the veteran and their caregivers. Do military caregivers often find support from other families? I think, you know, maybe that's one thing we think of, oh, they're in the military, they're in a military community. Is that easy for them, or do we just take that for granted thinking, oh, they could just talk to their next door neighbor?
I think we do take it for granted to some extent. When we spoke to military caregivers, while they are yearning for that connection with other caregivers, they may be spread out, and so they may be in different places across the country. You also have to think about the reliance on the reserve and guard that we've had with these particular conflicts, and so our reserve and guard members are living distributed throughout communities as well. They're not on military installations. They may not be in communities that have a large number of other military families. And so they're out there in your neighborhoods, in your communities, and they may not be connected to other military families or other military caregivers, but they have found each other online and through some kind of the social media opportunities for that relief, just that opportunity to talk to somebody that understands what it's been like to walk in those shoes.
One of the caregivers on the panels also talked about care coordination and how her husband was assigned a case manager, but ultimately the coordination of care was falling to her, and she had no support from the case manager. So just maybe repeating again some of the things we could do in practice to help them tracking schedules, because in this case her husband had a traumatic brain injury. He couldn't remember anything with his schedule. It all fell on her with a full-time job and also 2 kids. What are just some of the things we could do at point of care, and what if the caregiver isn't with them? How can we get them involved?
Right. Well, I think that is a great part of the question. How can you get the caregiver involved? If you're seeing a military service, current or former military service member, and they are experiencing a disabling injury or illness, I think it's important to ask them if they do have a caregiver, and if that caregiver is someone that you could communicate with. Often that caregiver maintains the best medical record right in their brain. They may be the only one that has all of the information about every single injury, every surgery, every other provider that they're seeing. So they're the glue that kind of tries to piece it all together. And often they aren't afforded the opportunity to be able to have those conversations with the providers directly because of powers of attorney and appropriate kind of privileges in different healthcare settings. But it is that caregiver that is the connector. While there are lots of programs that can assign case managers, that case manager is often only focused on that particular program. And so you have to think about it from the caregiver's perspective, that they are the center trying to put all of these pieces together. And they do face enormous burdens in doing that because it is difficult to coordinate across providers, but they are often the only ones that can do that communication across providers. As you all know, it's difficult sometimes to coordinate care with providers in other settings and other specialties because you don't often get a chance to talk on the phone unless you're in the same setting. So really recognizing and utilizing that that caregiver as the connector and the facilitator of a continuous and coordinated care approach.
Can you discuss what your research showed about increased health risks for the caregiver themselves because of the role they play?
Sure. And most of what we learned comes from the research that's been done on the civilian caregiver population. And so while we think it's applicable to the military caregivers, there are some studies that show it's a little bit worse. So first, caregiving takes an enormous amount of time. About a fifth of caregivers say that they spend more than 80 hours a week providing care to their loved one. And over 2/3 spend at least 20 hours. So this is, more than a part or full-time job. They report high rates of physical strain. They also report higher rates of disease, like coronary artery disease, hypertension, sleep problems, and overall declines in health. They also have higher mortality rates than non-caregivers. So this is a population with health risks. They put off their own health-related needs, often kind of shoo-shooing the need to see the provider themselves or attend to their issues. They report high rates of mental health problems and stress, particularly depression. The rates of depression among caregivers range between 40% and 70%. That's so much higher than in the civilian non-caregiving population. They also report that they have effects kind of on the job, so that they have to reduce the number of hours that they work outside the home. This can in turn cause financial hardships, and this can lead to a kind of downward spiral, particularly as they take on more caregiving roles and the burdens. They are spending less time with what would be their social support network, and so this cascading spiral can kind of accumulate and really place that caregiver at increased risk for poor health outcomes.
And how can we identify a military caregiver in our practice? So they're not there for the veterans' health, they're there for their own health, but maybe for something routine. How can we identify them so that we can look out for them and decrease some of their increased health risks?
Sure. Well, you all know your practices better than I do, but I would first suggest get to know your patients. As you're doing your workup and your evaluation, ask the question if they're from a military family. Ask whether or not they're providing care and support for a wounded, ill, or injured veteran. And try and understand and acknowledge that you recognize that it probably took some great sacrifice for them actually to get to the provider, and that they probably had to kind of put aside their caregiving responsibilities for that period of time, which is incredibly stressful for them to find that respite care, that replacement care, and acknowledge the burdens, just trying to understand that you recognize that this can be overwhelming and intense. But because they are at increased risk of poor health outcomes, getting to know a little bit about the issues and how you can facilitate them ensuring that they get the appropriate medical attention and care that they need as well.
Thank you. Well, thank you, Terri, for being here today. In the last couple minutes, can you just tell us what are the take-home points? I mean, what we do as PAs is we fill gaps in care. So what can we be doing in our practice? What can we take back to our practice to make sure that we are thinking about meeting the unmet healthcare needs of the military caregiver population?
Sure. Well, first, recognize that you are probably already seeing military caregivers. They're likely already in your practice settings. And to the extent that you can acknowledge them, recognize them, and work to identify their specific health needs. But also recognize that while that's at your individual practice level, there still needs to be a generation of more information to ensure that we can reduce those gaps in care. While you're all out there at the practice level being those gap fillers, continue to do that while we focus on generating information that will allow us to kind of create the system that will support the process as well.
Great. Well, thank you, Terri, for taking the time to talk to us today about this important topic. And thank you all for coming to listen to it and taking these thoughts back to your practice. Thank you very much.
Thank you.